Hi, my name is Kimberly Crowley. I'm a nurse practitioner student with the University of Athabasca. This is my submission for assignment number 1 for Nursing 518. Mrs. Brown is a 43-year-old Caucasian female with a history of hypothyroidism and depression. She presented to the clinic today with a cough that she has been experiencing for the past 6 days. She came to the clinic today for an urgent visit, and I've seen her previously for a UTI. She describes herself as generally healthy prior to experiencing her current symptoms. She has not seen any health professionals previously for evaluation of this concern prior to this clinical visit. She denies any previous respiratory concerns. Ms. Brown reports experiencing cold symptoms such as rhinorrhea, sore throat, headache, and malaise 10 days prior to her clinic visit, with her cough beginning 6 days ago. She states she experienced a low-grade fever 9 days ago, which lasted for approximately 2 days. She reports the cough began as intermittent and non-productive and has progressed to a productive cough approximately 3 days ago. She reports her cough is productive for a moderate amount of white-yellow sputum. She denies any pink or blood-tinged sputum, and she also denies vomiting with her cough. She also denies any heartburn or regurgitation. She reports experiencing dyspnea on exertion, but denies experiencing it at rest. Mrs. Brown reports poor sleep since her symptoms began, as her cough frequently keeps her awake during the night. Her associated symptoms include headache, lethargy, muscle soreness, and retrosternal discomfort at times. She rates the discomfort as a 3 on a scale of 1 to 10. She reports that her cough is aggravated by lying down, exercise, and when at work. She works in an office building. She has tried cough drops and states her cough will subside for approximately an hour and then will return. She has also been taking acetaminophen 650 milligrams for her discomfort and has found that to be helpful. Mrs. Brown has 2 children who has also experienced cold symptoms previously to her symptoms developing. She is up to date on all immunizations and has had her flu vaccine this year. For predisposing conditions or risk factors, she states that she has a sister who has asthma. And for pertinent negatives, Ms. Brown denies any family history of COPD, heart failure, or lung cancer. She denies any recent travel or any recent contact with anyone who has had pneumonia or COVID-19. And she also denies any recent unexplained weight changes or weight loss. For medication, she takes levothyroxine 100 micrograms daily, citalopram 20 milligrams daily. She takes a multivitamin daily, and she has no known drug allergies. For past medical history, she was diagnosed with hypothyroid at the age of 30. She was diagnosed with depression 5 years ago following her divorce, and a tonsillectomy at age 5. For social history, Miss Brown is a secretary. She divorced 5 years ago, like I said, and has 2 children, ages 12 and 15. She's a non-smoker. She drinks occasionally. She has 1 to 2 glasses of wine every 1 to 2 weeks and denies the use of other substances. For objective data on her general appearance, Mrs. Brown appears tired but otherwise generally healthy. Her blood pressure is 112 over 67. Her pulse is 78. Her respiratory rate is 18. Her temperature is 37, and her SpO2 is 99%. For her respiratory exam, Ms. Brown shows no signs of cyanosis in her hands or lips. She's noted to be breathing regularly without the use of accessory muscles. There's no audible wheezes heard. On palpations, there's no evidence of increased tactile firmness. Percussion of the anterior and posterior chest shows resonance throughout. On auscultation, vesicular sounds are present over most lung fields, and however, wheezes are heard throughout, but clear when the patient coughs. There are no crackles, rales, or bronchi noted, and voice transmission test shows negative for bronchophony and egophony. For HENT, she has mild pharyngeal erythema. Her frontal and maxillary sinuses are non-tender. She has 2 soft, mobile, non-tender nodes noted to her right posterior cervical chain. And for vascular, there's no evidence of edema in her extremities, and her JVP measured at 3.5 centimeters, which is within normal limits. In summary, Miss Brown is a 43-year-old female who presented to the clinic with a productive cough following the development of cold symptoms. Her cough is productive for white yellow sputum. She presently does not have a fever, but did have a low-grade fever 9 days ago. Her vital signs are stable, and there is no evidence of lung consolidation on her respiratory exam. My primary diagnosis is acute bronchitis, with my differential diagnoses being pneumonia, asthma, and GERD. Thank you.